Thanks for staying with us. Today we'll be taking a closer look at some of the successes of Governor Babajide Sanwo-Olu. Here with us now is the Honorable Commissioner for Health, Professor Akin Abayomi. Welcome to the show, sir.
Thank you. Good morning.
So we're looking at the review of the current governor of Lagos State, and we can't help but remember the work that was done during COVID. And many have said that he was a successful leader that championed the fact that COVID did not overwhelm the nation as a whole. Could you give us some excerpts of what happened during that time, the challenges he had to face, and how he triumphed over COVID?
Yes, so, I mean, we all recognize that Lagos is one of those mega cities. It's a coastal city, it's low-lying, it's rapidly expanding. It has a very vibrant airport. It has multiple seaports, it has an international border, and it has connections to the rest of Nigeria. To feed 20 to 30 million Lagosians, you need to bring in a large volume of livestock. So when you put all that together, it's low-lying, heavily populated coastal megacity. It adds up in biosecurity parlance to high levels of vulnerability. So as you know, in government, you look at what's happened before, you look at what's happening around the world, and you look at what the projections are. And we've been experienced in the past with Ebola, with Lassa fever, with cholera, with flu. And we know how fast things can get out of hand. So in Lagos, we have this offensive approach to pandemic or biological shocks. We know our vulnerabilities, and we know that we need to intervene very quickly to make sure that whatever comes our way, we can get on top of it. So after Ebola, we were really very worried about what could have happened in Lagos. We were able to get on top of Ebola, but many of us traveled to Sierra Leone, Liberia, and Guinea, and saw what devastation Ebola rendered onto the economies. So we came back to Lagos, and with the then Commissioner for Health, Dr. Jide Idris, we were able to build on the past infrastructure to develop what's called the Lagos State Biosecurity Roadmap. WHO were telling the world that to expect a global pandemic within 5 years of that Ebola outbreak, which meant somewhere around 2019, 2020, we were to expect something big. And indeed, they were right. But we were listening to them, and we were preparing. Most people didn't know what we were doing. You know, why are you preparing for something so big? What's the deal? But luckily, we were able to be ready. And the day we heard about Wuhan, it was almost a couple of weeks after we commissioned our Lagos State biosecurity infrastructure. And so we just ramped things up, and you know, we in cabinet, we identified that Lagos was at some point not going to be able to avoid COVID-19 because of our movement between Nigeria and China, movement between Nigeria and Europe. We started to see COVID spreading around the world, and it was just a matter of time. You know, so when we got our index case, we were actually fairly well prepared. You know, we had the infrastructure, we had the human resources, we had the equipment. We learned a lot of lessons from Ebola, and so for us, it was time to be aggressive and offensive, you know, and make sure that we diminish the opportunity for the virus to get into the Lagos community. And once it got into the Lagos community, we were able to put in place all our standard operating procedures to make sure that community transmission was minimized. But as a government, you know, our main function is, and you know, when you heard that the Economist voted Lagos and Nigeria the 4th best COVID management environments, what they said was not how many people were saved or how many people didn't die. What they actually said was these were the countries that were able to keep their economy open despite a pandemic. You know, because we are really looking at human livelihood and security. At the end of the day, you can be too heavy-handed. We call it the tripod of biosecurity. You can be too heavy-handed with your public health response, and at the same time cause economic hardship, which leads to breakdown in law and order and loss of security. And then you lose more people from your economic hardship and your breakdown in law and order than you would lose from the pandemic itself. So government has to find that balance. And Mr. Governor really was fast to respond. He set up the incident command structure, which means that the management of COVID was elevated to the cabinet, the highest level of authority, which made it easy for us to make quick decisions and get on top of things.
Okay, so I know that when you compare Lagos to most of the states, it's nothing to compare, really. We have a lot of people coming into Lagos for medical care, what they can't access in their states. But let's talk about the primary health care centers. What was the situation that this current administration met, and how has it upgraded so far? Okay.
So we inherited quite a number of primary health care facilities. We have over 320. A lot of them were just repurposed buildings. You know, so a local government chairman would identify an old office or a school and say, okay, we're going to convert this into a PHC. That's one. Very few of them were purpose-built. And many of them are very old, going back 20, 30 years. So many of them have some degree of wear and tear. The other thing is that according to the national rollout plan for PHCs, we're supposed to have at least one PHC per ward. Now, the way Lagos is designed, we find that sometimes we have 2 or 3 PHCs in a ward, and some wards don't have any. So we're looking now at 2 things. Mr. Governor has put in motion what we call the blueprint for medical transformation, which is looking at infrastructure and designing infrastructure fit for purpose at all 3 levels: primary, secondary, which are the general hospitals, and our specialist hospitals. So we got a group of international designers working with local designers who are experts in medical design, and we've developed what we call the blueprint for our transformation. And the first to roll off the blueprint was 3 prototypes of our PHCs. And these are beautifully designed, taking into consideration the movement of the sun, ventilation, the soil, the heat, infection prevention control, cultural practices. And we've come up with this beautiful design, and we're now beginning to roll them out in Lagos State, especially where we don't have a PHC in a ward. We've started to build.
How many has been built so far?
Well, we've just started the first 4. The blueprint came out 2 months ago. It took us about 2 or 3 years. Even during COVID, we were working on this blueprint. Right. So we've just got permission and approval to start. We're doing 4 this month. We're starting, and then another 10 throughout this year. Going back to the established PHCs, all those ones that we have identified that need refurbishment, we have approval to start working on those, which we've started. We've started going out to all the places where we've identified these PHCs. And the primary healthcare platform, you see, is the foundation of the PHC. And Governor Sanwo-Olu has said, look, we need to decongest the general hospitals and the specialist hospitals because we need to manage most of our patients at the PHC level.
Okay, I would like to also talk about, yes, so infrastructure is there, but also we need to talk about affordability of healthcare. And I would like to know what this present administration and Governor Sanwo-Olu is doing with Lagos State Health Management Agency. That's the agency that's in charge of insurance for Lagos residents to get for health coverage.
So every state in Nigeria has what's called the Social Health Insurance Scheme. So for us in Lagos, it's called Ilera-Eco. Ilera-Eco is your health insurance, and up until late last year, insurance was more or less voluntary. You know, now the new National Health Insurance Authority signed a new bill. Mr. President signed the NHIA bill, which had a major change in the law, which said that state health insurance is now mandatory, which means that if you're a Nigerian or if you're Lagosian and you're living in Lagos, you're doing business in Lagos, you're breathing Lagos air, just like if you are driving a car in Lagos, you must have insurance. You have insurance to drive a car, you must have insurance to live in Lagos. So every citizen needs to buy an insurance. We've done a lot of actuarial work on it. It's very modest. It's only 8,500 naira per person for an entire year. That insurance affords you access to a bouquet of services. Basic services like hypertension, diabetes, birth control, immunization, management of pregnancy, birth of a delivery of a child, cesarean sections, minor surgical procedures, the bread and butter of what all our citizens go to doctors for. 80% of patients, their conditions can be managed at a PHC, at the primary healthcare level. Complications, they get referred to the general hospitals. And if the general hospitals with all their specialists can't manage it, maybe it's a super complicated case, then that goes to LASUTH or to LUTH. Of course, we have private sector that are doing incredible work as well. So, we have this hierarchy of referral.
Right.
But we want the bread and butter to remain at the primary health care. And the insurance that we're talking about, everybody with that insurance, you take your card, you go to your PHC or your private sector, wherever you're enrolled, and once you hand in your card, you don't get charged until you exceed the bouquet of services. Right. And then there's a fee for service after that.
So, COVID was a case in question that, really tested the how will I say, competence of this government. Mm-hmm. I wanted to, talk, because I had COVID, I went to the center, I had to do a test, and I went back and forth. How did you get the doctors to stay? What exactly did they do, to get the doctors motivated enough to stay and fight with you guys?
So the COVID response, the medical personnel were divided into two. We have our biosecurity team who are centered around the infectious disease hospital. They're accustomed to dealing with very dangerous pathogens. So we've been training them for about 4 years before COVID. We had extensive training that if we knew that we needed other medical personnel, we had trained them just in case we needed to recruit them. But what we did during COVID was to separate COVID management from normal medical care. So we only managed COVID in about 3 or 4 of our hospitals and left the rest to deal with normal healthcare requirements and health-seeking behavior of our citizens. And that was a deliberate strategy on Mr. Governor's part because we didn't want collateral damage. So, if every hospital is designated a COVID hospital, then people will not go to the hospitals because they'll be scared to catch COVID, So people going for hypertension, diabetes, surgery, birth, and everything. In fact, we dropped the tariffs completely during that COVID period, and we saw an increased surge of people going to the rest of our hospitals for normal medical care, whilst we maintained COVID in designated centers.
Was that insurance package something to motivate those doctors to stay more? Because, yes, this is part of their duty. They had this call that they must, adhere to, but was there a special package?
Yes, we had a hazard allowance, a special hazard allowance, and then lots of overtime because they were working 24/7. They couldn't even go home. We kept them in hotels because we were worried at the beginning that they would infect their families,
right.
So we put them up in hotels. We fed them, we gave them special hazard allowance. So they were, prepared for the outbreak.
Yes, I just wanted to when you talked about insurance, you talked about the 8,500 that a Lagos resident has to pay. But is there anything that's been done by this administration for those who cannot afford to pay that amount?
Yeah, we have what's called the equity fund, where the government has a register of less privileged citizens who might even find 8,500 a bit too much to pay for the year of insurance. So through that equity fund and through a lot of donors, we are able to pay for citizens who feel that that fee or that tariff is too much for them, and so we pay for them. And so they can access the LERECO.
Let me come to the issue of research, because during COVID, one of the things we saw was the fact that many universities were actually seeing what they can do, how the vaccines that were provided was research based on university work. And we're really worried that in Nigeria, we didn't have any kind of proper research institute that was providing solutions. So I heard somewhere, I don't know if it's right or not, but Lagos State was also getting involved in research. Is that correct? Could you verify?
Absolutely. Yeah, from the word go, because, you could have done a cut and paste. What are they doing in UK? What are they doing in Brazil? What are they doing in China? And just apply the same to Lagos. But from the very first index case, And then the subsequent cases, we already put together a very strong research team from University of Lagos and from Lagos State University Teaching Hospital. And there was a team of about 40 researchers that were looking at every case of COVID and observing the natural history of COVID in Lagos. And we found that there were significant differences between COVID here and COVID in different parts of the world. And indeed, other parts of the world found that COVID behaves differently in different ethnic groups. So we're able to adjust our response based on our indigenous understanding of what COVID does to our citizens. And that made a very large difference to how we're able to respond to the outbreak.
Okay, we know that we have a pandemic of brain drain across Nigeria, so to speak. And doctors just feel they are not getting enough commensurate to the work that they are putting in, and they opt for other countries. What has Lagos State, that's with this administration, done so far to keep their doctors here? And what's the plan going forward?
Okay. So we're looking at several things. First of all, if you talk about infrastructure, what is it that our medical personnel, when we talk about medical brain drain, it cuts across all cadres, doctors, nurses, allied medical professionals. So we're looking at the environment. So we're going through this blueprint I mentioned before, which is transforming the infrastructural landscape of Lagos State. Where you work, like I'm looking in this studio, and this is a nice studio. You want to come to work. So our infrastructure is very important for the mental welfare of our staff. So we're going through a massive transformation. We're building new hospitals, the Massey Street or George General, the psychiatric unit, infectious disease research center. These are all beautifully designed hospitals that take into consideration the welfare of our staff and our patients and look at climatic factors as well. We're looking at their welfare packages. They have a lot of issues around their packages, which we've been addressing consistently and engaging with them. We're looking at medical tourism. So we want to make, in the Lagos State Development Plan for the next 30 years, Lagos needs to be the medical destination for medical tourism. For us to do that, we need to look at why our doctors are leaving Lagos and going to seek health in India, Dubai, South Africa. And we found that there are about 5 top reasons for that. So we're concentrating on that. One of them is cancer. The other one is heart and kidney and orthopedics. So we're developing these centers here. And what we're trying to do, people talk about JACPA. We're now talking about JACPADA. So it's brain drain and brain gain. So our doctors from Nigeria in the diaspora, they want to come home. But what are they coming home to?
Okay.
So we need to now develop those specialist facilities for them. They've gone away and spent 10, 15, 20 years excelling in specialties, subspecialties of medicine. And then you ask them, come back home. Come back home to do what? So a brain surgeon needs a place to come home and do brain surgery. A heart specialist needs a place to come back and do specialist heart investigations and procedures. A kidney specialist needs a place to come and do transplant. A cancer specialist needs a place where he can offer modern cancer therapy. So we are developing these facilities. So we're trying to reduce the push factor by improving the conditions of our doctors and medical personnel at home. And we're reversing it so that even if they do go, and there's nothing wrong with doctors going abroad. Doctors go abroad to develop themselves. They go abroad to get a broader experience of what's going on in the international environment. We want that. But what we do want is we want them to come back.
Attract them back. Yeah.
And that's the brain drain strategy that Lagos is using. And it has started working because our facilities are already attracting medical specialties from the diaspora. And these specialists that work in the diaspora, they're very mobile. They can even carry out a consultation on Zoom. Yeah. They fly in, they do what they want to do, they fly out, they go to another part of the world. So the world is changing. Digital technology is changing the way we deliver healthcare. And I think we're taking advantage of that.
Let me let Nima throw in the last question.
I just wanted to know what packages you have for other members of the health team, the nurses, the lab scientists, all of the other people.
So we're working on every cadre of, we're engaged with all of them. Is it the allowances, the salaries, the accommodation, We're looking at accommodation for medical personnel in all our hospitals now so that we can make life more comfortable for them. We're looking at hazard allowance. We're looking at better pay packages. We're looking at more comfortable working environment. We're looking at just elevating the respect, you know, and the whole atmosphere of the medical ecosystem.
All right, I think we can wrap up on that. Thank you so much.